Please join us in a moment of silence. Madam Clerk, please call the roll.
Anderson?
Present.
Olive?
Here.
Juris?
Here.
Madigan? Here. Marks? Here. Allen?
Here.
O'Leary.
Here.
Reading and disposal of the minutes of the regular meeting of council held January 5th, 2015.
Move to adopt without the necessity of a reading.
Second.
Is there discussion on that motion? All those in favor?
Aye.
Those opposed? That motion passes.
Madam Chair, I should record my vote as abstain.
Thank you. Please let the record reflect that Councilman Bullock is abstaining because he was not present at that meeting. Thank you, Councilman Bullock.
Item 1, Committee of the Whole Report regarding February 9th, 11/17, committees addressing letter of intent, Committee of the Whole Report of February 17th, 2015, regarding Resolution 87-7114 and Ordinance 215.
Thank you, Madam Clerk. Ladies and gentlemen, members of council, the Committee of the Whole met February 9th with the Cuyahoga County Health Commissioner, Terry Allen. Council asked Commissioner Allen to give the public health perspective on health and wellness and what it means to a city the size and demography of Lakewood. We asked him to define population health, discuss the social determinants of health, and to review the services for which we contract with the Cuyahoga County Board of Health. The context in which he presented is twofold. Number one, the rapidly changing healthcare environment nationally as well as locally. And number two, our consideration of the proposed changes to Lakewood Hospital. In addition, Director Gelsomino presented the city's Health and Human Services perspective of our investments in public health and what we need to continue to do to achieve strong families, children ready for school, seniors supported by their community, and community health and wellness. This was the second of our committees of the whole dedicated to exploring the many and varied layers of the letters of intent which was submitted to City Council. We need to have background in order to ask questions and make an informed decision about the future of healthcare and a healthcare facility in Lakewood. All members were present, as were the mayor and Director Butler. 5 members of the public attended. Commissioner Allen explained population health as the alignment of public health and medicine. The discipline considers factors such as housing, education, air and water quality, transportation, safety, health behaviors, and clinical care within a whole picture of a healthy person and a healthy community. He used examples of restrictions of tobacco use, improved education about tobacco and its use, and increased sales on tobacco products as three public health tools that directly impacted positive health outcomes in the state of Ohio. He shared national, state, and county level assessments that rank physical health and social and economic outcomes for communities. Council asked about relevant health risks, current health treatment, and appropriate ways to measure health here in Lakewood. It was a vibrant discussion. Nationally, Commissioner Allen tells us that research tells us that our health outcomes, that is, the quality and length of our lives, that these outcomes are influenced largely by factors other than medical care. We make decisions about diet, exercise, chemical use. We feel the effects of our health, of our physical environment, like air and water quality, and we live with social determinants of health. Sometimes those are out of a person's control. Those determinants are education, income, safety, family and social support, among others. The formula now accepted is that 20% of our health outcomes are about access and quality to clinical care, while 80% is attached to policies, programs, and personal choices. The Cuyahoga County Board of Health is available to assist with research, mapping, and any other public or private health care questions. The meeting began at 7 p.m. and ended at about 9:15. Move to receive and file this report. Discussion on the move to receive and file. All those in favor?
Aye.
Those opposed? And that motion passes. I have another report, so I will move to receive the second one as well. The Committee of the Whole also met Wednesday, February 11th, with Lisa Fry, a partner in Subsidium Healthcare, the consultant hired by the LHA, the LHS, and the Cleveland Clinic Foundation in July of 2013 to analyze strategic options for Lakewood Hospital. All members of council were present, as were the mayor, directors Butler and Pay, and 7 members of the public attended. Ms. Fry was asked to come into the Committee of the Whole so that members could meet her and ask her questions about the process Subsidium used with the LHA, that's the Lakewood Hospital Association, to explore the healthcare market and possibilities in Lakewood. Her presentation focused on the timeline, which is available on onelakewood.com, and the context of choosing a partner for healthcare here in Lakewood. An expanded version of her presentation to council is also available on onelakewood.com. Council asked questions about property, value, finance, service trends, changes to service since the lease began in 1996, and other questions about the lease. Some shared personal experiences and concerns about trusting the clinic as a partner in the future based on the perception that services have been denigrated over time. It was a vibrant discussion. The public was invited to ask questions, and some did, and some made comments as well. The meeting ended at 6:47 p.m. Everyone left to attend the community meeting in the auditorium. Move to receive and file that report. Is there discussion on that movement? All those in favor?
Aye.
Those opposed? That motion passes. I have yet another Committee of the Whole report. Tonight, the Committee of the Whole met to consider an item before us. Present were all members of council, with an excused absence was Councilman Anderson. The mayor was present, as were directors Siley and Butler. Tonight, at Committee of the Whole, we considered item ordinance number 2-15, which is an ordinance allowing the mayor to enter into a purchase agreement to sell 2.88 acres that make up the former McKinley School site to a company called Liberty Development Company for $500,000 to construct approximately 40 residential units. This conversation began in the fall of 2013 in order to reposition this site for an alternative and productive use. The City of Lakewood and the Board of Education identified a number of mutual goals, including creating residential options, bringing additional consumers into that neighborhood, and most importantly, adding to the tax-paying base to support the schools and our city government and other public agencies. Liberty Development was selected for this partnership after our usual Lakewood-style, very thorough public process that went through the Planning Commission, ARB, and numerous public meetings. We have now 2 pieces of legislation before us tonight, which we are considering. I want to cover, first of all, that the $500,000 cost, or sale price rather, covers our cost for clearing, cleaning, and carrying that land for the time since from the Lakewood Board of Education for almost 2 years, approximately 2 years. The Committee of the Whole voted unanimously to approve, to adopt ordinance 215 at tonight's meeting. Move to receive and file that long verbal report.
Second.
Is there discussion on that? All those in favor?
Aye.
Those opposed? And that motion passes. Madam Clerk?
Item 2.
I one more thing to say about the Committee of the Whole. We are considering filling one final seat for the Planning Commission, a very important position, and we move to defer that decision until the next time council meets in full, which is Monday, March 2nd, which will be in time for the next Planning Commission meeting. Move to receive and file that other part of the report.
Second.
Discussion, those in favor? Aye. That motion passes. Madam Clerk.
Item 2, Resolution 877114, a resolution appointing blank to the Planning Commission.
Move to
defer.
amend.
There's a move to defer on the floor.
Second.
All those in favor? Aye. Those opposed? Director Butler? Madam Clerk?
Item 3,
No, I think we have to do, I'm hearing to defer.
Madam Chair, I'd like to move to amend item 2.
We have a motion and a second on the floor.
You do, and I think you took a voice vote that was
We did.
inconclusive, so I think it makes sense to do a roll call on that motion.
On the motion to defer, please take a roll call because it appears to be inconclusive.
Anderson,
Yes.
Bullock,
No.
Juris,
Yes.
Madigan,
Yes.
Marks,
Can I ask for some clarification, please?
Yes. To Councilman Marks, this is the move to defer until next Monday's, into the next full council meeting.
Yes.
Nowlin,
Yes.
O'Leary.
No.
That motion passes. Councilman O'Leary and Councilman Bullock. We will consider this as we decided. We'll consider this at the next full council meeting.
Item 3.
Madam Clerk.
Item 3, Ordinance 215, an ordinance authorizing and directing the Director of Planning and Development to enter into a purchase agreement with Liberty Development Company
Move.
to sell the real property located at 1351 West Clifton Boulevard pursuant to Section 15507 of the Codified Ordinances placed on first reading and referred to the Committee of the Whole, 1/2015, second reading 2/2/15.
Move to adopt.
Second.
On the motion to adopt, is there discussion?
Madam Chair.
Councilman Bullock.
Yeah, I wanted to simply reflect for a moment on the legislation we have in front of us. As part of council's oversight function, we often ask rigorous and tough questions of our colleagues in the administration and of one another. I think it's also fair to compliment when compliments are merited in any of our opinions. So I wanted to do that tonight. I think what we have in front of us to execute the proposed redevelopment of the McKinley site is remarkable. It's an opportunity that we get only rarely, as the mayor said previously, and to make effective use of that is no small feat. So I wanted to acknowledge Mayor Summers' leadership, Drew Siley, our planning director's leadership. I think this is one very worth taking a bow. So job well done, gentlemen. And of course, to actually build what's depicted in the pretty drawings is also no small feat, but that's something that we've got controls over and some means to hold those construction firms accountable. So simply didn't want to let a significant moment pass without acknowledging that. Thank you.
All those in favor?
Aye.
Those opposed? And that motion passes.
Item 4, Planning Commission report regarding recommendation McKinley School Site rezoning ordinance 315.
Director Siley.
Thank you, Madam Chair, members of council. Direct your attention to my correspondence. Piggybacking on what was just approved for the development agreement, thank you for your support and your counsel in developing the zoning for this project. As you can see from that correspondence, Planning Commission recommended unanimously to recommend to council adoption of the proposed McKinley Place plan development. As I mentioned in the committee of the whole meeting, that approval will become an exhibit and part of the development agreement that was just approved by council. And thank you again for your support.
Thank you. Move to receive and file the communication.
Second.
Discussion? All those in favor?
Aye.
Those opposed? That motion passes.
Item 5, ordinance 315, an ordinance to amend section 110502 of the zoning code of the city of Lakewood by changing and revising the zoning map of the city with respect to certain property as set forth and described as 1351 West Clifton Boulevard.
Move to adopt.
Second.
Is there discussion on the motion to adopt? All those in favor?
Aye.
Those opposed? That motion passes.
Item 6,
Thank you,
ordinance
Mr. Siley.
415, an ordinance to amend section 903.10, duty to repair and maintain sidewalks of the codified ordinances to remove the requirement that a sidewalk survey be included with the notice to repair, placed on first reading and refer to the Public Works Committee 2-215.
Move to place on second.
Second.
Is there any deliberation? All those in favor?
Aye.
Those opposed? That motion passes.
Item 7, communication from Councilmember O'Leary regarding a request for economic impact study of Lakewood Hospital closure and proposal set forth in letter of intent between Cleveland Clinic, Lakewood Hospital Association, and Lakewood Hospital Foundation.
Councilman O'Leary.
Thank you. Dear members of council and the public, the purpose of this communication is to respectfully ask that council consider drafting and publishing a request for qualifications to identify a firm that could produce a study of the economic impacts of the closure of Lakewood Hospital and also the potential economic impact of the proposal set forth in the letter of intent signed by the Cleveland Clinic, Lakewood Hospital Association, and Lakewood Hospital Foundation. As we all know, Lakewood Hospital is an integral and long-standing institution in our city, the activities of which affect the city, its businesses, and its residents. The closure of Lakewood Hospital and the implementation of the proposal from the Cleveland Clinic would both have profound effects, not only on the city of Lakewood's finances, but also on individuals, businesses, and other entities within our community that go well beyond the loss of rent and income taxes paid to the city. These impacts could include the additional loss of jobs or revenue in businesses such as restaurants or shops that are heavily trafficked by Lakewood Hospital patients, employees, and visitors, as well as the potential for an exodus of medical professionals and their associated practices following the relocation of portions of the city's healthcare delivery infrastructure to Fairview Hospital and Avon facilities. In addition, there may be further impacts which we have not yet undertaken to comprehend, let alone measure. It is, in my view, essential that we both identify and measure the impacts of this sea change before we are left struggling to cope with unanticipated consequences. I hope that my council colleagues and members of the mayor's administration will join me in a collaborative drafting process to ensure that this study is adequate in its breadth and pragmatic in providing city officials with the perspective needed to further deliberations and negotiations. Respectfully submitted. Thank you, Madam Chair. And I would ask that this communication be received and filed and referred to Committee of the Whole for discussion.
So there's a movement to receive and file it and submit to
Second.
Committee of the Whole, and a second. Is there any discussion? Councilman Juris?
Great. Thank you. Just to be clear, I'm trying to visualize what exactly we're requesting here. Obviously, this can be deliberated within Committee of the Whole, but we've got a pretty hefty amount of work to get through there already. So if we can get some of this fleshed out tonight, I think that would be helpful. Is the intention to evaluate two conditions that we're trying to weigh a decision on, and which two conditions are we to look at as we're preparing to draft an RFQ? What variables are we looking to look at? Are we looking at the conditions that existed in one period of time to the LOI? Are we looking at conditions that have been forecasted in 2018 against the LOI? I'm trying to determine how this will be useful to help us make a decision. Not to mention that I think if we look back to 1996, there were far more employees that were working at Lakewood Hospital, and yet some of the businesses that were identified in the communication weren't there in 96, and in fact are doing quite well with fewer employees. Obviously, anytime that we have a change in the number of employees, there's going to be a change in a number of related businesses. But what two items are we to evaluate in an economic impact study?
Councilman O'Leary?
Thank you, Madam Chair. So I think that one obvious answer would be the conditions under the proposed letter of intent. So that would be something that I think would be helpful for council to have in terms of hard data to look at. If the proposal under the letter of intent were to go forward, what are all of those economic impacts? So I think that that's one identifiable scenario. I think that part of the reason for the communication is to seek exactly the kind of exchange that we're having now from council members and other members of the public or the administration as to exactly what condition we would want analyzed in the alternative scenario. But for me, I think one of the questions that could use more data is what would the potential impact be if the hospital were to no longer exist on that site, and the city could potentially redevelop those 6 acres or look at another tenant for the hospital. I think that all of those things are potential for the first scenario, but I would seek that kind of input from colleagues and from members of the administration.
Councilman Juris?
Follow-up question to that. So, I guess I'm left with somewhat of lack of clarity of what it is that we're comparing, which two criteria we're to compare. Additionally, I'm trying to understand the timeline that's thought within this. Many times when we have these communications that are brought forward of, that could either just be received and filed or be referred to committee, what is the legislation or the intent, the legislative act that we're to follow up on? Or is it to go to committee of the whole so that we can then discuss it and prepare what the RFQ would look like? How long that RFQ would take? I mean, are we looking at, having gone through some of these RFPs before, it's going to take weeks to prepare it, it's going to take further weeks to publicly notice it, it's going to take follow-up time to review and analyze it, and then at the end of the day, we'll have a report that says, yes, if you lose employees, you're going to face an immediate impact, and then there'll be a question of what we backfill the space with, or how that space gets reoccupied or repurposed. I would tend to think that a lot of this information will come out through the due process that we have in place already, to have some of these discussions, and then if at that time we say we still have unknown variables, we still have information that's required, we need to go out and seek further assistance on it. Certainly it makes sense to start preparing our moves now. However, what I see is a referral to committee of the whole to talk about something rather than saying, here's the document that we can release and here's the information that's going to be necessary. I would prefer to see that this is a prepared item to be referred to committee, that we can then say, yes, that makes sense, and have that preparation done offline, outside of committee of the whole, with the administration, with the individuals involved, so that we can isolate what is the cost of this, what's the timeline, what is it that we're deciding on, versus bringing this into committee of the whole to discuss it then, when we haven't even discussed some of the other factors of real estate and economics and finances yet. Certainly it's good to queue it up, but I think it would be a bit premature to refer it into committee and have this there for a discussion versus having it there to say, here's the timeline. We're going to need another 12 weeks to be able to walk through an RFQ, an RFP, whatever it may be, depending on how clear we are on what we need.
Madam Chair.
Councilman Leary?
Sure. Thank you for the opportunity to respond to that. I think that I can certainly appreciate those concerns. I'm with you in wanting to see the information yesterday.
Sure.
I think that ideally, knowing now what we know, that some were having these discussions for an extended period of time, I think that, under ideal circumstances, we would have a much broader base of data already to be making our decisions on. We don't have that yet, and I think in deference to your concern, this was an attempt to make sure that we aren't going back 12 weeks from now, 16 weeks from now, and saying, oh wait, there's this impact that we didn't, again, try to even consider, let alone measure. And now we're back to square one in terms of figuring out how it is that we measure that, or how we should weight that factor in our deliberations. And so I think that this process would allow for plenty of opportunity for that expression to happen, as well as plenty of opportunity for drafting to be done offline and drafts to be brought back into committee. But I think that the notion that we would bring in a completely finished RFQ for an up or down vote in committee of the whole was intentionally something that I was trying to stay very clear away from, because I think that there are a lot of voices and a lot of valuable input to be had in this process, and I don't think that coming to the table with something that's preformed is necessarily always constructive.
Councilman Joyce?
So am I understanding that the expectation is we'll go through the information we have currently first? Or is the expectation that this will be referred and that this committee of the whole will begin immediately trying to develop an RFQ as a body? What's the next step?
Councilman O'Leary?
Thank you, Madam Chair. To your point, I would say that individual members of committee of the whole can be as involved as much or as little as they would like in the process of drafting the RFQ. And I would certainly be happy to try to bring a draft to committee of the whole for discussion, if that's something that the members have a preference for. But I think that, exactly to your point, I don't know, I can't speak certainly I can't speak for the chair of the committee of the whole, nor can I speak for other members of the committee of the whole. So the order in which this is, I would like to see a request for qualifications go out as an initial step in our deliberations, because as you said, the timeline can stretch. So there's the idea that we should at least take these initial kinds of steps as soon as feasible. And then I think also that there's a notion that we need to view information to make decisions. And so I think that, to your point, I think that we can go ahead and request information that we know that we want to look at as we're in the process of reviewing information that we already have. I guess I don't see them as mutually exclusive in any way, or that one comes at the cost of the other. I think we can put out an RFQ and continue to have productive deliberations while we await more information that we desire and responses to the RFQ.
Thank you. Councilman O'Leary, how much are you willing to set aside for this process? We have, I think, $10,000 in our budget for consultants.
Thank you, Madam Chair. On that point, I know that the city has retained professional services for communications consulting on this matter. I think that we should look at a similar commitment level to get the facts in addition to communicating them.
Yeah, Mr. O'Leary, I'm talking about the council budget. So you're submitting this for council to do this separate. So how much do you think a council budget should, what should we bring into the council budget to do it? Because we don't have, I think we have somewhere around maybe 8 to 10 in our budget. So what are you anticipating this will cost?
I think that we can evaluate that relative to all the other. I guess I don't know, not looking at any other expenditures that we might make this year from that budget, what it is that we would be prioritizing.
Okay, I'm trying to suggest that we're going to have to think about how much a consultant to do an economic impact study would cost,
Sure.
separate from the economic impact that we learned from Subsidium. So,
I didn't see
So-
an economic impact study there.
well, probably not in the form that this is requesting, but certainly part of what they did was telling us what would happen within a variety of suggestions. So another part of my question is, are you willing to spend the same amount that was spent for Subsidium?
How much was spent for Subsidium?
Oh, it was at the last meeting, it was.
500,000.
Please, well, you can speak, there was quite a bit of money spent on Subsidium. But, I mean, I'm asking what your budget is for this. In addition, do you have a budget for the resources to write it, or would you be writing it along with members of council?
This letter indicates that I would be seeking input and help from other members of council.
So we would do it in-house?
I think that, I guess I would say that I think we can look at potential collaboration with either other in-house entities or other private contractors or entities that we might contract with. But I wouldn't be presumptive to suggest an amount out of hand that I think would be fitting.
Okay.
I think that that's part of why you submit the proposal, is to get a sense from private actors what they might charge for something like that.
Okay, so that would be one thing that I hope we could get is an estimate of what you're suggesting that we spent on it. And I wouldn't want anything unless we really considered the impact of doing nothing and what the impact of doing nothing would be 5 years out and 10 years out. And another piece, what the impact would be of doing nothing by the end of 2015 and finding the clinic just running out the lease. So that's another piece of it that I would want. In addition, what footprint are you considering for the economic impact study?
What do you mean by footprint?
What's the radius around the hospital that you're looking at?
I think that the appropriate thing to do would be to measure the impact on the city.
So the entire city? Not
Yes,
just the
and I-
businesses in and around the hospital?
Well, I think that it depends on whether or not there's strong evidence to suggest that businesses outside of a small radius are going to be profoundly affected. If it appears that there is not an effect that would be far-reaching geographically, then I wouldn't see the point in studying a non-existent impact. But if it appears that the impact would extend throughout the city, say, as city council, I think it would be logical for us to examine the impact on the city.
So the footprint is the entire city. And I would be also interested in comps going back to 1996, if that's what you're considering. I think Councilman Durst made a good point. And are you aware of the RFP? You're aware of the RFP to hire legal counsel, correct?
Yes.
And the scope of the service of all of that. And so in addition to that, you would want a study, another study with some of the parameters that you have listed here, in addition to some of those that were suggested tonight. So there's a separate study in addition to what we're hiring a law firm to do.
Correct. I would not be looking for legal representation from an economic impact study firm.
But you have seen the scope of what the law firm is.
Yes, I'm
Yes,
familiar
okay.
with, yes, it was, yes.
Thank you. Is there further discussion?
Madam Chair?
Councilman Anderson?
Yeah, I think that, the correspondence is appropriate. I appreciate it, and I think that the questions asked tonight are fair. You know, me personally, I would like to see, what the comprehensive list of items that would be included in such an economic impact study, and then cross-reference that by what we already have. I'm not seeing a whole lot of direct economic impact analysis in the subsidiary report, but it might be there, just needs to be teased out of it. So we cross-reference that, we identify the items that we don't have any data for, and then we make a determination whether or not we need that data to go forward. So for me, the initial step is seeing what a comprehensive study would look like, seeing what we already can fill in the gaps with, and seeing what's missing, and if 4 or more members of council want to go forward with trying to identify the study that could fill in those additional gaps, if we think that they'd be proven beneficial to our deliberations on this matter. That's how I originally read this. Starting point, I have some questions, fair questions tonight. What do we want? What's missing? And is it worth the effort to get some of those missing pieces to help us with our deliberation? So I thought that, again, that's how I read it tonight, and I appreciate the opportunity to speak on this, and hopefully we'll have a conversation soon in the committee of the whole. So thank you.
Is there further discussion? Councilman Marks?
Yes, I would just like to say that I can appreciate this correspondence, and I'm sure that it will help us have a conversation to access more information. I would expect that the citizens of Lakewood expect us as council people to do our due diligence in asking all the questions, regardless of how involved they might be. But my feeling is that this decision is going to have an impact on the face of Lakewood going forward. And these are not decisions to be made lightly, but to consider all opportunities for information. I myself requested information from Subsidium last week and still have not received it. I would expect information to be immediate and forthcoming. This is a lot of information to digest, big decisions to be made, and I was not privileged to have access to this information over the last 2.5 years or 3 years. So I do want to make sure that I have all the information available to me, and I would expect, and sometimes I'm not even sure of the questions to ask because I don't have enough information before me. So, so I can appreciate that Councilman O'Leary wants to know how this is going to impact the city overall. And some of that information has been shared to us by the mayor, and how we may look to tease out more money when we lose that tax base from the payroll taxes. But I would appreciate having this information so I can move forward in a more deliberate fashion in making decisions that are in the best interest of the city. So thank you, Councilman O'Leary, for bringing this forward.
Further discussion? Councilman Bullock?
Thanks. Just briefly, we're a deliberative body, so, and we're of course sticklers about adhering to what is the law, which is open records and sunshine meetings and so forth. So for us to initiate a deliberation with one another on any topic, including this one, requires one of us to put something forward on the docket. So I do hope that we support one another on council in our efforts to deliberate. And I take this communication in the spirit of deliberation, which is needed. And I want to applaud you, Council President Madigan, for the very rigorous and thorough council schedule. I find myself saying, be careful what I wish for, because it might come true, and you're leading us through very rigorous deliberations. So I think we're underway, off on the right thing. So reserving the right to see the specifics and the mechanics of a potential RFQ on a potential study. We've identified some of the initial questions that might need to come into clear focus for a specific economic impact study, and I think that's fair. But I wouldn't want us to cast cold water or shut down deliberation. We are a deliberative body. The other thing I would say is I would support, and I think it's entirely appropriate, if we would have a consensus to move forward with such a study to reserve and authorize and appropriate funds for a study and not have to carve it out of the council budget. I think it's a very legitimate purpose, whether it be legal counsel or economic analysis or any other such thing, that we would find and reserve the resources from the city budget to inform ourselves. Now, say that in a general sense. I haven't thought through the specifics of what Councilman O'Leary's inviting us to consider today. It may be that we need the study, it may be that we don't, that we can find the information from communication with the administration of Lakewood Hospital Association. But at any rate, I did want to say that I may have other questions that I want to initiate, or I may want to initiate on other topics that aren't related to the hospital, council initiatives on bicycling or something, and not be constrained to the council budget. Thank you.
Thank you. As we all know, we're in charge of the budget, so whatever we want to spend on bicycles or economic impact studies or whatever it is, we can make happen. So we're all clear and we know that. Any further discussion? On the motion before us, all those in the motion, to remind everybody, is to receive and file this correspondence and place it before the committee of the whole. On that motion, is all those in favor?
Aye.
Those opposed? And that motion passes.
Item 8, communication from Councilmember Anderson regarding discussion to identify entity to serve council and residents regarding the future of Lakewood Hospital and healthcare delivery in Lakewood.
Councilman Anderson.
Thank you very much. Dear colleagues, as we've come to understand, Subsidium Healthcare was hired by the governing board of Lakewood Hospital Association to develop a strategic options review process. Later, this role came to include deliberating with the Cleveland Clinic via 7 formal negotiating sessions in addition to numerous additional calls and discussions, which culminated in a letter of intent, non-binding, which is before us now. By all accounts, Subsidium has served that entity very well. However, extending the logic for utilizing a consultant on this important matter suggests that council would also benefit from fair and objective feedback and analysis to come to our own informed decision on the matter concerning the future of Lakewood Hospital, as well as healthcare delivery in our city for decades to come. While I feel certainly that we can learn from Subsidium's extensive effort to date, I feel the council would benefit from a continuing discussion as to the best entity to serve council and residents. I accordingly ask the council initiate a thorough discussion and process that would determine the entity to consult this body in the coming weeks and months. 2 quick add-ons include my appreciation to you, Madam President, and as your role as the chair of the committee of the whole, and to my council colleagues for sort of having a quick discussion about this notion last week. I appreciated the openness to having the discussion about what's the best entity to serve us. And my second add-on is understanding now that we've moved a bit more closely to determining legal representative for this body through the RFP process. And again, I just wanted to use this opportunity to communicate on a docket and reinforce the conversation that I initiated last week in Committee of the Whole. And again, respectfully, I ask that this communication be received and filed and referred to the Committee of the Whole for further consideration.
Second.
On that motion, is there discussion? Councilman Anderson, I would ask your consideration of some of the same questions. Should we find someone, I'd look to you for the parameters of what you're looking for exactly, and an estimate of the cost for this consultation, and or perhaps you feel that the RFP, which has gone out for legal counsel, which has a fairly deep scope, if that would satisfy you. So the same, similar to what we just discussed with Councilman O'Leary's correspondence, the same kind of background work for consideration at Committee of the Whole. As we all know, we've got committees of the whole that go through May, as we should, and they may go longer. We know that we've got every Monday tied up, possibly coming up some Thursdays, Friday nights, when which is the days you're available, and possibly Saturdays. So I would ask for great clarity and a lot of homework done on these kinds of studies that we're asking for, so that we may consider them in Committee of the Whole more thoroughly as they come up. So thank you.
Madam President.
Yes, Councilman Anderson.
Thank you. I don't feel that this communication is asking for a study. I think this communication is asking for us to have a conversation as to whether or not Subsidium or the legal counsel will meet our needs as a deliberative body to go forward with the discussion. I'm not calling for a study.
Okay.
I'm calling for just additional discussion. Up to the point of last Thursday, I don't remember really having a discussion on council or committee of the whole as to whether or not Subsidium and the extensive work that they've done on the part of the Lakewood Hospital Board is what we need to have that conversation, to come to our conclusions. So I'm just looking to have that conversation. This is not, I don't think the conversation is going to cost us any money. I think
Fair
it'll
enough.
cost us a little bit of time, but I appreciate what you're saying. I think it's important for us to be careful about how we're putting our intentions forward. So my intention is that I just want to have a bit more of a deep dive into the conversation as to whether or not this council is confident with the work that's being done by Subsidium to help us come to a conclusion. I think a lot of it is valuable. I think some of it I have some real questions about. I have to say that it's wrong, I just have questions about it. And similar to Councilwoman Marks, I've also reached out to Subsidium and gotten no response on a couple of occasions. Maybe we're going to spam. It's not my responsibility to check Subsidium's spam mail. So I just want to make sure that we're getting the response and the information that we need to make an important decision. And if it's good with council that this is the direction that we need to go to answer all of our questions, then I'll definitely acquiesce and go along with that. But I'm not asking for a study.
Okay, great. Thank you for that clarification, because I'm just reading in the second paragraph, and that's where I'm reading that perhaps it would be to benefit from an objective feedback and analysis. So I'm
Perhaps.
reading that as a completely separate entity to guide council, which, fair enough, that is what any one of us can ask for. To your point, you made a good point. If we're reaching out separately, which we are all able and allowed to do, obviously, let's also coordinate with Monique and Mary to just tell them what we're asking for, because we are all doing this part-time. They can follow up during business hours and follow up during the day. They're keeping a list of questions that come in from the community. They're keeping a list of questions that come in from all of us. Let's centralize things so things do not slip through the cracks. We are using every single committee of the whole, including those on, as I said, the first and third Monday, to ask questions, and the mayor will be there or someone else will be there to ask those questions. Let's make sure we track the questions or requests for information from Subsidium. So the clerk and Mrs. Smith will help us do that, if that's fair enough. Is there further discussion?
Madam Chair.
Councilman O'Leary.
I'd just like to thank Councilman Anderson for this communication. I think it is exactly the kind of deliberation that council needs to be having on this important topic. And to speak to my own thoughts on this issue just briefly, I was able to have a short conversation with Law Director Butler last week with regard to the request for qualifications that's currently out for legal representation in this matter. Initially, when I read and reviewed that, I had read it quite narrowly, that we were seeking a firm to consult with the city on the drafting of a definitive agreement with the clinic. In speaking with Law Director Butler, I now understand that we would be requesting more broad-natured counsel than that. I would hope and assume up to and including litigation should the city decide to go that route. So I think that this is a conversation that is very time-sensitive, to be sure, one that we want to get underway as soon as we can, and I welcome this communication and look forward to discussing it further. Thanks.
Any further discussion? Again, we have a motion and a second before us to move this correspondence into the committee of the whole. All those in favor?
Aye.
Those opposed? And that motion passes.
Item 9, communication from Finance Director Pay regarding 2015 first quarter transfers and advances.
Director Pay?
Thank you. Attached
attached is the first quarter transfer ordinance, which is 25% of the total anticipated transfers between funds that were included in the 2015 appropriations, as well as $273,000 that was advanced from the general fund at the end of last year to 4 separate funds that need to be paid back. Please place on first reading and refer to the Finance Committee for further discussion.
Move to receive and file that communication.
Second.
Discussion? All those in favor?
Aye.
Those opposed? And that motion passes.
Item 10, ordinance 515, an ordinance authorizing the transfer in advance of certain funds.
Move to place on first and refer to finance.
Second.
Discussion? Those in favor?
Aye.
The ayes have it.
Item 11, communication from Finance Director Pay regarding $12,027,000 renewal of 2011, 2012, 2013, and 2014 various purpose general obligation bond anticipation notes.
Director Pay.
Thank you. The attached correspondence and subsequent ordinances reflect the City of Lakewood's debt issuance for general obligation bond anticipation notes totaling $17,377,000. This includes a little over $12 million in prior year borrowing that we are refunding this year, as well as $5.35 million in new money for projects that we will be doing this year as listed in the correspondence. Please refer to the Finance Committee for further discussion.
Thank you. Move to receive and file the communication.
Second.
Discussion? All those in favor?
Aye.
The ayes have it.
Item 12, ordinance 615, an ordinance authorizing the issuance of notes in the amount of not to exceed $12,027,000 in anticipation of the issuance of bonds to pay the costs of renewal of 2011, 2012, 2013, 2014 various purpose general obligation bond anticipation notes, general obligation bond anticipation notes, $5,350,000 in 2015 general obligation bond anticipation notes for new capital projects.
Move to place on first and refer to finance.
Second.
Is there discussion? Director Pay, in ordinance, that's 6-15, correct? In ordinance 6-15, there is dollars in this for constructing the West End Sewer Separation Project. And then also in 7-15,
The dollars that were allocated in ordinance 6-15 are the design portion of the project, and the ordinance 715 is the actual construction. So the design took place this past year, and then the construction will take place this year.
Thank you. That answers my question. Are there other questions on this? All right, so we are considering placing on first and moving to the Finance Committee. All those in favor?
Aye.
Those opposed? That motion passes.
Item 13, certificate of estimated life and maximum maturity.
Move to file.
Second.
Is there discussion? Those in favor? Aye. The ayes have it.
Item 14, ordinance 715, an ordinance authorizing the issuance of notes in the amount of not to exceed $2 million in anticipation of the issuance of bonds to pay costs of West End Sewer Separation Project, together with all necessary appurtenances thereto.
Move to place on first and refer to finance.
Second.
Discussion. Those in favor?
Aye.
Those opposed? That motion passes.
Item 15, certificate of estimated life and maximum maturity.
I move to receive and file the certificate.
Second.
Is there discussion? All those in favor?
Aye.
Those opposed? That motion passes.
Item 16, ordinance 815, an ordinance authorizing the issuance of notes in the amount of not to exceed $1,500,000 in anticipation of the issuance of bonds to pay the costs of resurfacing Arthur Avenue, Carabel Avenue, Cliffdale Avenue, Cook Avenue, Cranford Avenue, Edgewater Drive, Edwards Avenue, Garfield Avenue, Kenneth Avenue, Lake Point Drive, Mayo Avenue, Nicholson Avenue, Ogons Avenue, Owega Avenue, Rockway Avenue, Sloan Subway, South Marginal Drive, St. Charles Avenue, and other streets located within the city.
Thank you, Madam Clerk. Move to place on first and refer to finance.
Second.
Those in favor? Aye. Oh, Councilman Black.
One question for the administration, if I may. The list of named streets would imply that we have a final list of named streets. Typically, we wait and see what the snow has brought us. Do we intend to update the named list if circumstances do turn out that the brutal cold has made changes in pavement?
Yes,
Thank you.
the streets, the streets that are listed are from the results of the PCR report, pavement condition report that was done, but again, it will all determine based on condition of streets once we finally have nicer weather and just what the cost will be. So this is the tentative list, and when we go forward to bid, then we'll have to file.
And follow up, when will the snow go away? Will you have that information first?
On the motion, all those in favor?
Aye.
Those opposed? That motion passes.
Item 17, certificate of estimated life and maximum maturity.
Move to receive and file the certificate.
Second.
Is there discussion? All those in favor? Those opposed? That motion passes.
Item 18, ordinance 915, an ordinance in the amount of not to exceed $950,000 in anticipation of the issuance of bonds to pay the cost of improving parks within the city, including Lakewood Park.
Move to place on first and refer to finance.
Second.
Is there discussion? All those in favor?
Aye.
Those opposed? That motion passes.
Item 19, certificate of estimated life and maximum maturity.
Move to receive and file.
Second.
Is there discussion? All those in favor?
Aye.
The ayes have it.
Item 20, ordinance 1015, an ordinance in the amount of not to exceed $650,000 in anticipation of the issuance of bonds to pay costs of improving sidewalks within the city.
Move to place on first and refer to the finance committee.
Second.
Is there discussion? All those in favor?
Aye.
Those opposed? And the ayes have it.
Item 21, certificate of estimated life and maximum maturity.
Move to receive and file the certificate.
Second.
Discussion? All in favor?
Aye.
Those opposed? That motion passes.
Item 22, ordinance 1115, an ordinance in the amount of not to exceed $250,000 in anticipation of the issuance of bonds to pay the cost of replacing or improving the roofs of City Hall Annex, Winterhurst Ice Rink, and the city's service garage.
Move to place on first and refer to finance.
Second.
Discussion? All those in favor?
Aye.
Those opposed? That motion passes.
Item 23, certificate of estimated life and maximum maturity.
Move to receive and file the certificate.
Second.
Is there discussion? Is there discussion? All those in favor?
Aye.
Those opposed? And that motion passes.
Item 24, communication from Law Director Butler regarding updates to Chapter 145, Keep Lakewood Beautiful Board.
Director Butler.
Thank you, Madam Chair. I'll commend the written communication to your attention, but suffice it to say that Keep Lakewood Beautiful Board has requested that we make some updates to Chapter 145, which governs their membership and their activities. And so I'd ask that the following ordinance be referred to an appropriate committee for your consideration. Thanks.
Thank you. Move to receive and file the communication.
Second.
Is there discussion? All those in favor?
Aye.
Those opposed? And that motion passes.
Item 25, ordinance 1215, an ordinance amending Chapter 145, Keep Lakewood Beautiful Board and codified ordinances in order to update the code regulating the composition and duties of this board.
Move to place on first and refer to the Public Works Committee for this conversation.
Second.
Is there a discussion on this? I would just say that Keep Lakewood Beautiful is always looking for new members, so if there's anyone out there tonight or watching on YouTube, we could use you. All those in favor?
Aye.
Those opposed? That motion passes.
Item 26, communication from Law Director Butler regarding formalization of Western Lakewood Clean Water Pilot Program.
Director Butler.
Thank you, Madam Chair. On behalf of Mayor Summers, Public Works Director Beno, and Finance Director Pay, I submit for your consideration a resolution that, if adopted, would formalize and provide contracting authority for the Western Lakewood Clean Water Pilot Project first announced to affected residents about 1 year ago and continuing through today. Pilot program, which will assist the city in further characterizing its sewer system, is part of the city's permitting obligations to both the Ohio EPA and the US EPA. It is intended to cover certain homes on Atkins Avenue, Eldred Avenue, and Delaware Avenue south of Hilliard Road. The hallmark of the program, which provides city assistance to participating homeowners, is that it will assist the city in determining how corrections made to residents' century-old private property sewer systems might impact the level of combined sewer overflows reaching Lake Erie and the Rocky River in wet weather. Many details of the program may be found in the guide attached to the resolution, which is a draft at this point. We also plan to meet with the residents of the pilot project neighborhood on Tuesday, March 3 at 7 p.m. in the Harding Middle School cafetorium. And certainly would welcome your attendance. Meanwhile, please refer the legislation that follows this communication to an appropriate committee for further discussion. Very truly yours.
Thank you. Director Butler, move to receive and file the communication. Is there any discussion on the communication? All those in favor?
Aye.
Those opposed? That motion passes.
Item 27, Resolution 879415. Resolution establishing a pilot program in Western Lakewood to remove clean water sources from the city's sanitary sewer system in the furtherance of the city's permitting under the Ohio Environmental Protection Agency, contracts for professional services for the pilot program, and to advertise for bids and enter into contracts for the purchase of repair, maintenance, and operating supplies, services, and equipment for the pilot program as authorized by the administrative code of the city with the lowest and best bidder or bidders, or as otherwise provided by law, in an amount not to exceed $900,000, declaring a nuisance and identifying resident payment options under the pilot program.
Move to place this resolution before Public Works.
Second.
Is there any discussion?
Madam Chair.
Councilman Bullock.
Thank you. Briefly, I'm reviewing the proposed legislation, but haven't had a full chance to digest it. Just from flying from 35,000 feet, the intent here, if I can infer correctly, is to allow the city to have a pool of funds to make corrections on just the public side of the property line or the private side of the property line, or both. Can we briefly speak to that?
Madam Chair.
Director Butler.
Thank you. Councilman, it's both, but this legislation actually only impacts the program on the private side. We've already been undertaking work on the public side. Is that me? We've already been undertaking work on the public side, and that's under our general contracting authority and appropriations ordinances that we've passed in years past and this year. This program just affects the private side, which is something that we have not undertaken except in very limited examples around the city.
In recent years,
Yeah,
at
and
least.
the goal of the program is really to see if corrections that we make that would address the inflow of stormwater or groundwater into the sanitary lines that extend from a person's home to the street, and then from the street to the combined sewer overflows or the Rocky River or the Lake Erie in wet weather events. Those improvements, of those corrections on the private side can actually impact the inflow of stormwater into the sanitary lines. What causes those overflows? We are determining, we are learning that what causes those overflows is the addition of clean water to the sanitary lines. And somehow or another, that water has got to get to either the treatment plant or the receiving waters of Rocky River and Lake Erie. It's that latter instance that we're under orders to correct under the orders of the Ohio EP and US EPA.
Understood. And quick follow-on. So the question is this program, has this proposed program gotten as far as deciding whether the city's going to pay or the private resident would pay in full or in part to reimburse the city, and therefore this proposed appropriation of up to $900,000 would be a pool of operating funds, which then the city would recoup along the lines of what we are successfully doing with the sidewalk program, for example. But in the sidewalk program, there is a whole range of specific circumstances. Sometimes the city pays 100%, sometimes the resident pays 100%, and there are circumstances where it's a shared responsibility. So we may have not have gotten that far, but I'm just interested to hear the status of the administration's thoughts on this.
It is in the guide attached to the legislation, Councilman, and the proposed program has the city paying 100% of the costs of remediation on private property up front, but subject to the owner's reimbursement of the city over time of either upfront or overtime of 10% of those costs. So it's a deferred payment plan of 10% of the city's costs in performing the work.
And thereby providing an affordable, quite an affordable means of financing these repairs. And I suppose the logic there would be that the city is upfronting the cost of a test case method for potentially fixing or addressing
That's right. And then
the problem.
it not only helps us determine whether or not the improvements will improve our status with respect to overflows, it also helps us determine whether or not those improvements are affordable and a similar program
A scaled up version of this could be practicable.
could work elsewhere in the
Yeah.
city.
I think it's fascinating and interesting, and I look forward to the
I do believe the mayor
proposal.
wanted to add on.
If I may, there's one point that's important to understand. Law Director probably referred to our administrative orders, and there's a timeline to these orders. There's an expectation that we're going to do certain things in these orders, and one of them is by our mutual commitment that we would do this pilot study to prove or disprove the merits of source control. The alternatives being the big storage tank under Clifton Boulevard or a radically expanded wastewater treatment facility. And it's our contention that we need to prove or disprove this. We have to do it within the confines of 5 years. So our hope is that by creating a 90-10 split, 10 to the homeowner, we can get this 100-house test phase done in a time frame that will allow us to meet the expectations of this permit over the 5 years. So we got a lot that we agreed to. We have to get it done. We want to stay out of federal court, and this is one quick way to do it. One of the many ways we have to do it.
All that makes sense, and I appreciate what the administration is driving at, so look forward to continued presentations and discussion.
Thank you, Councilman Bullock. So to add on to that, for this meeting on March 5th, did you do drop and through the mail? How are you letting the community know? I know they learned the last time and it was a fairly successful meeting, but now that we're possibly talking 90-10, it's even more critical to get people there.
It'll be all of the above, but it's really targeted
Okay.
at 100 houses.
Yeah, so it's limited, but still. Okay, thanks. We've come to the end of our agenda. We have 2 members of the public signed up to speak. Katie Kurtz. Hi, Katie. Thank you for being here. If you would just, I know what you're here for, that's great. Just your name and your address for the record.
Sure. Thank you for having me. My name is Katie Kurtz. I'm unfortunately not a Lakewood resident. My address is 23425 Belmont Drive, Westlake, Ohio. I just want to thank you for having me this evening. I'm representing the leadership team for the Lakewood Family Collaborative. And Lakewood, along with other surrounding suburbs, are all too familiar with the devastating effects of opiate and heroin addiction. What sets Lakewood apart from other cities in Cuyahoga County is that we have not shied away from the realities of heroin and opiate addiction, and I really applaud Mayor Summers, the council members, and other community affiliates for the great strides that they have taken this year to really address the seriousness of this issue. The Lakewood Family Collaborative is honored to host a unique awareness event to emphasize the hope and strength of Lakewood. Heroin and Hope is an event that will be held on Wednesday, March 11th at 6:30 p.m. at Lakewood Methodist Church. We are offering
various opportunities for participants at this event. We are partnering with many organizations, including the Cleveland Clinic, St. Vincent Charity Hospitals, Rosary Hall, Stella Maris Cleveland, Adams Board of Cuyahoga County, New Directions, Ohio Guidestone, and other various organizations to offer specific resources for treatment, advocacy, recovery, and prevention. We're very gracious to have Special Agent Jeff Caprato bring a drop box for prescription medications, so participants can come with any unused or unwanted prescriptions and drop them off securely at this event. We are also happy to have Rachel DeSalle, who is a Lakewood native and Cleveland Plain Dealer journalist, speak, as well as Vince Caraffi of the Cuyahoga County Opiate Task Force, and Aaron Marks, who's a young man from Beechwood who will share his story of hope as an individual recovering from heroin addiction. And we are excited to partner with Metro Health's Project Dawn, Dawn standing for Deaths Avoided by Naloxone. We're offering a unique on-site naloxone training and kit distribution where folks can come and get this training and receive the kit on-site. We appreciate your support and hope to have your presence at this event.
Thank you, Katie. I appreciate you being here and the work that the collab does. I think it's a testament to how seriously the collab takes their work. It's about families. Thank you. Does the council have any questions? And you did say that was March 11th at 6 o'clock at the Methodist Church?
It's at 6. It starts at 6:30 at Lakewood Methodist Church. We also have free parking and free childcare.
What cross street is Lakewood Methodist Church? Anyone?
Summit.
Summit. Thank you. Thank you so
Thank
much
you.
for being here.
Thank you.
Councilwoman?
Councilman Marks.
Thank you, Council President. Katie, I just wanted to mention that when I did get the flyer from the Family Collaborative in my email, I was so pleased to see that we're sponsoring an event like that in Lakewood. I plan on attending just because I feel that awareness is very fruitful in our life. So thank you for putting that all together, and I look forward to being there.
Thank you so much.
Thanks. God bless you, Drew. Ms. Spencer?
No R on the
For
end.
the record.
Hi, I'm Ann Spence, and I live at 13939 Edgewater Drive in Lakewood, of course. And I'm 75 years old and lived in Lakewood all my life. My dad was born in Lakewood Hospital. I was born in Lakewood Hospital. My children were born in Lakewood Hospital. My grandchildren were born in Fairview Hospital because there was no maternity ward when they were all being born. And I may be requesting something in this meeting that I may be a meeting ahead, because I looked at the council schedule and I noticed that the next one is going to have finance on Lakewood Hospital, including assets. But one of the things that I would love to see, and I just started attending these meetings because I know Lakewood has to do something with the hospital. I came from business. I was a senior vice president and chief financial officer of a bank, and I spent my last 7 years bringing on board banks that Bank One was buying all over the country at the time that they were growing. So I've gone through a lot of this, and you have to make some decisions that are not palatable to everybody. I think the work that you're all doing and that Mayor Summers has done and that the consulting firm has done, I mean, is to be applauded, because you aren't doing knee-jerk decisions. But one thing that I would love to see when this is over and done is a hybrid pro forma balance sheet with the assets that are involved in this transaction. Now, the Lakewood Hospital Association or Foundation, I can't keep them straight, has got around 50 million or something is what they were discussing at the last meeting. And I'm saying hybrid pro forma because some of it might be coming off the balance sheet and some of it might be appraisal values. You've got the 850 Columbia building appraised at $8 million. You've got Lakewood Hospital, you can't provide that now because you don't have the appraisal. I would like to see that appraisal to show land, building, and equipment that is owned by the foundation. Then I would like to see that after all these moves are made. For example, and again, I'm just giving a couple examples. The Columbia is going to be sold at $8.2 million. So the $8 million appraised value will go over to, then I'd like to see the balance sheet for the Cleveland Clinic. 8.2 goes on their balance sheet, 8.2 comes in to ours as cash, or the city of Lakewood. I mean, I consider city of Lakewood mine. The same thing when we go through everything else, so that we see what happens to those assets on Lakewood side. There's going to be cash coming in. There's going to be things moving over to the clinic. I'd like to see what they end up with and what we lose and what the net difference is in those assets when this is through. And I haven't seen that actually on anything that the consulting firm has provided at this point. Again, I know something has to be done. I want to make sure that the city of Lakewood, the citizens of Lakewood get the best deal that they can. And again, thank you all for everything you're doing. It is appreciated. From those of us that come from the business side, because we understand that something has to be done. Thank you.
Thank you, Mrs. Spence. You're asking, next Monday will be the meeting you ought to attend, and one of your neighbors, Ken Haber, along with two people from the clinic, will be answering those questions. And you're speaking Ken's language, and certainly the language that has been started. And you're right, that has not been in what we've seen so far, but we will get there. So thank you, and we appreciate you coming from that perspective, and it is emotional. I think you're recognizing it. There's a huge emotion to all of this conversation, but we don't have. Speaking for some, I don't have the option of being emotional about this. We have to be very careful and make
business.
Absolutely, and we are all on your page, which is that we are all working to make the best decision for the next 50 years for the city. So thank you so much. That was encouraging, because you're acknowledging what we acknowledge every day and with nearly every phone call. It's difficult. Are there announcements from council? Hearing none. Are there announcements from the administration? None. I move to adjourn. Is there any discussion on that motion? All those in favor? Aye. We are adjourned. Thank you.